Good morning, my friends and colleagues. Thank you, Dana. It's a real privilege to be here. My wife Sheila and I have enjoyed Las Vegas so far, and I'm looking forward to sharing some thoughts and ideas with you. We herald from Canada, where it's in northern Canada, it's a little chilly at the moment, so this is a particular treat to be down here.
Use the mic.
I actually am using the mic. Okay, great. Thanks a lot. Okay. Basically, what I'm going to tell you this morning in terms of my thesis is that the totality of evidence is suggesting that bioaccumulated chemical toxicants, often from repeated low-level exposures, are the cause of many chronic diseases and immune problems. And the clinical relevance of this is that eliminating the underlying burden of chemical toxicants may prevent adverse health outcomes and restore health in those with chronic afflictions. So what I'd like to do this morning is I'd like to put things in context at an introduction. I want to talk about the pandemic of chronic disease. Then I want to ask the fundamental question, why do people get sick? Third, I want to talk about the plague of chronic human chemical pollution. Fourth, I want to put a little bit of a focus on an intriguing mechanism of illness that has recently been described involving immune system function. And then finally, I want to talk about what can be done clinically to make a significant difference in the lives of our patients. My friends, as the editor for The Lancet wrote in his journal, we have a neglected epidemic of chronic disease, right? And the Canadian government, the Public Health Department, summarized this a short while ago, saying that the burden of preventable death and disease has been growing rapidly, reducing the quality of life, increasing wait times for health care, and challenging the very sustainability of healthcare systems. And if you look nowadays, chronic care institutions are increasingly being inhabited by younger and younger patients. Throughout the world, the figures are showing that about 72% of the global burden of disease is related to chronic disease, and in North America, more than 80% and rising of healthcare is dealing with chronic physical and mental illness. What are these diseases that we're talking about, these chronic afflictions? If we look at the senior population, quoting the Chief Scientific Officer for the Alzheimer's Association, indicated recently that the number of people affected by Alzheimer's and dementia is growing at an epidemic pace and at younger and younger ages. But if we look at the younger population, and this comes from the Journal of the American Medical Association, where they were talking about the dramatic rise in chronic disease, I'll quote from them, that health and social welfare systems are unprepared for the rapid growth and demands that will arise from these epidemics. If we look at gender, the number, I used to work as an obstetrician gynecologist, the rate of gynecologic problems has been increasing dramatically. It's kind of interesting with young women. It appears that trouble with their periods and discomfort appears now to be more the rule rather than the exception. If we look at men, we also see rising rates of disease, including things such as prostate cancer, where there's been a dramatic rise over the last number of years. And if we look at different kinds of afflictions, for example, chronic pain, we're seeing increasing levels in the population rates of chronic pain, not only in adults, but also in adolescents now. There are specialists just dealing with this area, and there are waiting lists often for 1 to 2 years just to see a specialist dealing with chronic pain. One of the modern scourges is that of the pandemic of mental illness. When I went to medical school, I was taught that 1 in 20 patients, 1 in 20 individuals in our culture will develop a mental illness in their life. The recent figure out of the United States was that an estimated 26, or about 1 in 4 adults suffer from a diagnosable mental illness in any given year. And I just saw more recent figures last week in our country where they indicated that they estimated that 40% now of individuals will develop a mental illness in their lifetime. The tidal wave of cancer. 100 years ago, cancer occurred in about 3% of the population. Now, it's about a third of women and about 50% of men will develop cancer in their lifetime. And the World Health Organization just released the 2014 World Cancer Report, indicating that it doesn't stop there, that they anticipate a 50% increase in cancer rates over the next 15 years. My friends, modern medicine, we have unprecedented success addressing acute healthcare problems, such as trauma, cardiac events, infectious disease, neonatal care. But we have declining health of the population due to a rising epidemic of chronic illness. Now, when I've presented this information to my colleagues, there is pushback, understandably, right? And the first thing that they say is, what are you talking about, declining health of the population? We have increased life expectancy. The second thing they say is that we have an aging population because of the increasing life expectancy. So, of course, we're going to see more illness in older people. People have to get sick of something eventually. Or they'll say that these figures are an artifact. Well, let's look at these. Yes, there has been a dramatic increase in life expectancy. But the reason for this is the dramatic improvement in infant survival, right? Over the last 60 to 70 years, U.S. infant mortality has dropped by close to 90%. The way that we calculate life expectancy is that we just average out ages of death. So if you take somebody who dies at 80 and somebody who dies at 90, you add them up, 170 divided by 2, the average age of death is 85. But if you have somebody who dies at 90 and a child who dies, at a month of age, then it's 90 plus 0 divided by 2 is 45. So if you remove all those infant deaths, all of a sudden your life expectancy goes up dramatically. That's why there's the improvement in life expectancy figures. If you want to actually look at life expectancy rates, the credible way to do it is to look at life expectancy from age 60 forward. And over the last 60 years, in both men and women, it has increased by about 5 years. And that's primarily because of dramatic improvements in acute care, right? So contemporary medicine is incredible at managing acute illness. The challenge lies with managing chronic disease. The second challenge is that it's because of an aging population. But this rise in chronic disease is not restricted to those who are 90, right? I'll just quote again from the Journal of the American Medical Association that the number of children and youth in the United States with chronic health conditions has increased dramatically in the past 4 decades. We've seen rises in things like asthma, and we have an allergy epidemic, diabetes in children, now hypertension, myriad psychiatric illnesses in children, right? Look at autism. In the 1950s and 60s, the estimated rate of autism was about 1 in 10,000, an uncommon disease. But in 1985, it had risen to 1 in 2,500, and it's continued to rise steadily till the most recent CDC figures are 1 in 68 in 2010, right? Now, some people claim, oh, that's because, we're picking it up better and earlier diagnosis and expanding definitions. But recent study of epidemiology has shown that these only account for a very, very small, not the multiple thousand-fold increase in the rates of this chronic neuropsychiatric affliction. Right? Another area of pushback is that people will say that these numbers are an artifact. We're saying that, well, we're better at picking up conditions. Well, my friends, epidemiology is a credible specialty. And, many of the rises and many of the afflictions are diseases where definitions haven't changed. If we look at declining sperm counts, there hasn't been a change in measuring sperm counts. If we look at rates of suicide, suicide hasn't changed from 50 years ago. And accordingly, we're seeing, diabetes, for example. When Sir William Osler wrote his foundational book in medicine, Principles and Practice of Medicine, 1893, the incidence of diabetes was 1 in 50,000. Now, it's approaching 10% of the population, right? Infertility, okay, from 1985. about 1 in 20 couples. Now we're approaching 1 in 5. And in some areas, I just heard from another physician, some areas they're seeing at rates of 1 in 4. So the problem, my friends, is that we have increasing number of people, both young and old, who are seriously impaired by ill health. And the little bit of increase in life expectancy with earlier onset illness means that people are spending more of their life sick and struggling. But the astonishing thing is that all of this is occurring at a time when we have unprecedented resources devoted to clinical care, to research, to cancer study, and to health care in general. Right? If we look at the Canadian and American figures with regards to funding of health care, if we look at the slope in Canada, we see a dramatic ongoing rise. In the United States, there's been over a 10-fold increase in total health care expenditure over the last 30 years. And it doesn't appear to be changing anytime soon. In review, the evidence is showing that we have declining individual and public health, and the public health care systems cannot sustain the escalating demand for services. Okay. Why? What's changed? Something must have changed that all of a sudden we have this rate of rise of illness. So why do we have so many sick people? And what's causing this rapid and dramatic rise in both physical and mental chronic illness in both adults and children? In order to answer that, I want to explore the question of why do people get sick? Right? And I've spent a long time studying medical history. And it really is interesting to read about, what through the ages people have thought causes illness.